Hi everyone, it's Mary Bostic here, August 8, 2011, and I'm going to address the fourth week of our Know Better blog. So this week we were talking about social entrepreneurship, and our task is to address the social problem in Washington D.C. and list our ideas to resolve it. The topic that I decided to focus on is poverty in Washington D.C. Washington D.C. is amongst one of the cities in America that has the highest rates of poverty, and as a result also homelessness. So the way poverty affects Washington D.C. is that people who are on the margin of becoming homeless, who are living week by week, are suffering because they don't have adequate resources or adequate wages to provide for themselves or their families. And we know that the homeless consist of many people who are affected by mental illnesses or medical conditions, veterans from war who haven't received proper benefits, or even drug addiction can drive people to homelessness as well. And the efforts in the past, such as in 2004 with the 10-year plan to end homelessness, they're commended for at least trying, but many people comment that the results weren't good enough because during the 10-year plan to end homelessness, the rate of homelessness actually increased. So what we need to do is take it from a different angle. Instead of just adding housing assignments for the homeless, we also need to develop more and better programs to help them get back on their feet, such as helping them gain those skills so they can get proper jobs to receive proper wages, or helping them ace an interview if it means giving them a suit to go to the interview with. That can also help as well to help a homeless person get back on their feet. Another issue that Washington D.C. struggles with in its impoverished areas is the epidemic with HIV/AIDS. Is actually astonishing because in Washington D.C. the percentage, about 3% of the population actually has HIV/AIDS, and that's incredible because it's our nation's capital. And that rate is so high that in some cases the rate of HIV/AIDS in Washington D.C. is greater than in some third world countries, and that's hard to believe, but it's true. And the way that we can help the people who have HIV and AIDS in Washington D.C. but are too impoverished to help themselves are to create more centers and clinics that can help them receive medications, to live as normal as they can with the disease, and even to prevent HIV/AIDS. We can hold clinics to educate people on how to prevent STDs and HIV/AIDS transmissions in those impoverished areas, because in those areas people don't receive the proper care that they deserve. So that's how I would address poverty in Washington D.C., and consequently I would also be helping homelessness and the HIV epidemic at the same time.